Hello, everybody. Can everybody hear me in the back? That's always one of the biggest concerns. I'm Tasha. I am the PsychNet nurse practitioner here. I operate out of the public health building. I've been doing that now for 2 years. I absolutely love it. Prior to doing this, I did family practice for several years, so this has been a wonderful journey for me. So today our big thing is genetics, because as medicine continues to evolve, so many other things about medications come out, and we're like, well, why did this work for this person and not work for that person? We already have some things that are specific to genetics, such as like some of our chemotherapy stuff. That is pretty specific, so it's great that we have this option as well. Sometimes my technology is not great. So the biggest thing is GeneSight testing, which is something that we offer out of the behavioral health clinic, is very personalized. It's just for you. Nobody else is going to have the same, I don't know if you want to call it answers, as the next person. But a quick little, I guess this is a little science history for people. I'll make it as easy as possible. Genetics is what determines who we are, what we look like. The color of our hair, the color of our eyes, all of those things, how our body works, how we move, how we communicate within our body from different areas. Our genetics also influence how we react to different types of illnesses, medications, as well as like medical treatments, whether which would include the chemo, those types of things, and even when it comes to addiction. So basic things about our genes or DNA is that we get them from our mom and dad. So that is no way, you don't get them from anywhere else. You just get them from your mom and dad. We have 46 chromosomes. They come in 23 pairs. The last one, the 23rd pair, is what our sex chromosome is. All of the others get randomly assigned to us from our parents. It's like a Russian roulette, I guess. So the big thing to remember is that not only are we getting those genes from our parents, but we also have this gene expression that happens, which can change as we age. Some days, or when we're younger, it might be doing one thing, and then as we get older, it'll do another thing. These gene expressions are changed by our behaviors, so things that we're exposed to, whether it's environmental, like pollution. It also can be influenced by exercise and smoking. We've learned that smoking affects a lot of things in our lives. It even affects how we metabolize medications. So another thing is we all probably have heard of genetic mutations where one of our genes is a little bit weird and it does something. Not all genetic mutations are bad. Sometimes they're just there and they hang out, and then other times they can cause diseases or illnesses or anything, something like that. So, first thing is, what is GeneSight testing? This is a genetic test that looks at how our genes, that analyzes how genes influence on our individual response to medications. So, again, it is specific, it's only to you, it's unique, and our genes affect the multiple steps of how we respond to medications in our bodies. This GeneSight testing that we do is specific to mental health medications. There are other gene testing that is much broader and much larger, but the big thing about this is that it helps improve treatment outcome for our patients. So there's a couple big things in here. There's our pharmacokinetics and our pharmacodynamics, which is always difficult to keep straight. But anyways, the big thing with it is that our pharmacokinetics is what our actual body does to the medication. So it's like us metabolizing it. The pharmacodynamics is what the medication is doing to our body. So we will metabolize it a certain way, but then our body is going to, the medication then is going to do something different to our body type of a thing. It's a little confusing, but there's 2 steps. Because of this, we end up getting people who are partial responders to medications, or they might be somebody who's like a super responder, so they like would metabolize the medication really fast, or they would have high levels of it in their body, or maybe they don't have any. So that's why it's kind of important to know the pharmacokinetics and the pharmacodynamics. Again, here, kind of in depth, the big thing with mental health is, well, everybody has the P450 enzyme, and that's how antidepressants and antipsychotics are all processed. Big main ones is that 2D6 and the 2C19. If you ever read maybe the insert of a medication, you might see these abbreviations. It just tells us how the medication is moving around in the body, type of a thing. Our serotonin transporters with our SSRIs, so those are like our Celexa, Prozac, those types of medications. The big thing with those types of medications is a lot of these are start to work in our gut and get broke down and pass through. Well, our gut has a lot of serotonin in it. So when we take a medication that wants you to have more serotonin, we tend to get nauseated with it. It goes away. For the most part, it goes away. But again, some people that doesn't affect them because their serotonin that's in their gut is a normal level and not like a high level. So, then the HTR2A also is another response, and then the COMT is related to the breakdown of different neurotransmitters, and those are like our dopamine or feel good, happy things, and that's more for mood stabilization. So the GeneSight testing is super easy. It's super quick. There's not really a lot that has to be done. So in the office, it's just a cheek swab 10 times on one side of the cheek with one long Q-tip is what it looks like, and then on the other side. We then schedule a pickup and it gets sent to the lab. It goes to the GeneSight people, and then it's analyzed. And on most of the tables, then there's some stuff that kind of looks like what one may end up being. So, it gives us many different, or all the classifications of our mental health meds. So this one is antidepressants. The one on your guys' desks show antidepressants, and then on the back it'll show smoking related. And then I believe I have, and then I have mood stabilizers. I didn't put like the antipsychotics because it's essentially the same thing, because it's how it affects your body with smoking or without. But then we got mood stabilizers, stimulants as well, and then other non-stimulants. The last page is about genotypes and phenotypes, and that's just a little bit more detail. So the big thing is, when we look at this, we try to make it as easy as possible. We get this done, we get it back, we have a person either come back in and we say, hey, these medications are in your green category. This tells us that they are going to work. That does not mean it's going to be perfect. It does not mean that you might not still have a side effect, but this means that you are going to break it down and it's going to get moved around appropriately in your body to do what we need it to do. Then, our yellow is that there's probably a gene interaction. Some of these, it could be, probably should do a lower dose because when you take it, a lot of that medication stays in your body. Or it might be the opposite. You might need a higher dose because your body doesn't keep a lot of it. So the red is, probably shouldn't use that. Typically, I stay away from these because there is almost always some type of a genetic mutation that tells us it's a waste of time, don't use it type of a thing. And then you can see that these all have little numbers after them. So like even though this is green, it has the number 7 behind it. I don't have these all memorized. So the 7 means that this medication will change with smoking. So then it falls, so those two, that's Cymbalta and Mirtazapine. So then on the smoking, it moves from green to red. So that makes a difference. So we don't always ask people if they are smokers, and it includes smoking, vaping, any inhalation of any sort. So we don't always ask it just because we want to tell you should quit smoking. We ask it because you metabolize medications differently. So that's one of the big things to remember. So then like this number 3 with that medication it's allegedly, we don't use it anyways, but this tells us that it was kind of difficult for them to predict what it was going to do. So it could work, used with caution type of thing. And then over here are some of the more potent ones. The 8 is always the one that no, we're not going to do that because that's telling us that based on drug testing and manufacturing and FDA that your genetic makeup and that medication is going to be a bad thing. So stay away from that. So that's helpful. The wonderful thing, the big benefit about GeneSight testing is that it really does reduce a lot of trial and error when it's coming to picking out a medication for a person. Sometimes people can feel like they come to either to mental health or even the doctor and they're like, well, how do you know what medication to start with? Well, it's kind of, it sometimes feels like it's a dart being thrown and you're just picking one. But with the GeneSight testing, it really helps us eliminate that part of picking it and going with one that we know that your body's going to use right. It also helps people get better faster in a way. Because with most mental health medications, it is not like a Tylenol or an Aleve where you notice a difference in the next few hours or even the next few days. Like our blood pressure medications, typically we see a difference after a couple of weeks. Mental health medications is like 4 to 8 weeks. Some take a little bit longer and some are a little bit sooner if it's like a fast acting, like a lorazepam or something like that. So when we get people that say, I have been on 7 different medications and none of them work and I just don't know what to do anymore, this is a great thing. But I also ask, well, how long were you on each one of those medications? Because when they tell me it's only was a couple weeks, then I'm like, well, let's try again. Or if they say, no, I tried each one and it was about 6 months and it wasn't doing this, I don't want to feel like that. Great, so we do this. And because it's super easy to do, it makes it easy. Limitations. So not all medications are on this GeneSight test. The majority of all the ones that we prescribe on a mostly regular basis are, but it is only mental health medications. So it's antidepressants, it's anxieties, it's antipsychotics, mood stabilizers, and stimulants and non-stimulants that for ADHD. Also, it does not replace just normal clinical judgment. So that is the fine line in all types of medicine is, yeah, it's in the yellow, but we've done the things in the green, and the green was not, you didn't like it or it didn't sit well with you, so I guess we'll try the yellow and just have to pay closer attention to dose adjustments type of a thing. Also, again, environmental factors and other health things affect our response. So illnesses, whether it's like you're just sick with a cold, or actually sick with a chronic disease, addiction, that makes a huge difference on it, because it has to deal with how things are with our genetics and how things are metabolized. And then also other medications that we take or things that we eat or drink. So I don't know how many of you have been told, don't take this with grapefruit juice. I always think it's weird because I don't know a lot of people who drink grapefruit juice. I don't. So not something I ever have to worry about. But it's because the way that specific medication is broke down in the body will make it so there are higher levels. It's typically with like simvastatin. Everybody gets put on a statin and their muscles hurt and stuff. It's because the way that it is processed through our P450, I believe it's the 2D6, is that it makes it so there's a lot higher levels in it. So then you're going to get that side effect of the muscle aches, which is why then we change it. So we don't just say it just to make life difficult, just to let you know. And of course, these results are a guide. They're not definitive. So it's not black and white. It's just like when you go to the doctor for your blood pressure and one doctor's going to start you on lisinopril and then the other one is going to start you on hydrochlorothiazide. You talk about it over coffee or lunch with somebody else and you're both like, well, why did you do that? Why did they pick that one? Well, it's because there are a lot of other aspects in it. So, big thing is who can benefit from it. So, patients, obviously, who have treatment-resistant depression. That is something that continues to become more and more prevalent, is the treatment-resistant depression. So people could be on medications for years for the depression and still have it, and they just kind of get to this point where I'm like, I don't want to feel this way, nothing's really working anymore, or it works for a while and then it stops. It's a real thing in mental health that we get a bout, is what it's called, with the medication, where you might be taking it for 3 years and it's been doing great, but then all of a sudden it's not. Normally it's our SSRIs and our SNRIs. It's not typically our antipsychotics. This also is really good for people who tend to have a lot of side effects from medications. So that is one of the most wonderful things because people are sensitive to side effects, so we want to make sure that we're trying to minimize that. And also when we want to make people feel better as fast as possible. So not everyone just comes in and is depressed. Some people come in, they're depressed and they're hallucinating. So we want to make sure that we're putting them on the right medication to make sure that the hallucinations don't get worse, but also so it doesn't cause something else to happen. So that's pretty important. And then also for a family history of poor medication responding. So back to our parents. Because of them, we do inherit whether or not some medications may or may not work. I don't know if doctors have ever asked, oh, well, what did your mom take for this? Or what did your dad take for this? Well, the reason why they ask that is because half of our genes come from each one of them. The downside is, if you tell them that, oh yeah, mom's been on Prozac, grandma's been on Prozac, my aunts have been on Prozac, and it's all been great, yeah, that's typically what we choose. Okay, everybody else did it. But if you got your dad's half of that, then it's not going to work and we're going to have to try something different. So that is a very big thing to remember. So the big thing, future of pharmacogenomics is continue to expand it. So the big ones right now are already oncology and cardiology. We know a handful of medications and treatments through there that are going to be used in a certain way in our body to match up. It's like when we get with like breast cancer being tested for certain genes in there, then we know what medication for chemo to use, and then even if we have to use like the tamoxifen afterwards. So there are 2 types of genetic testing. In my office, we do GeneSight. The hospital offers pharmacogenomic. So the difference is the pharmacogenomic is not only mental health medications, but it's also certain cardiac medications and certain pain medications and like Coumadin, those types of things, which can be quite helpful because then it tells us, oh, that pain medication that we prescribed you the last 5 years when you came in because you broke your leg. That's why it doesn't work, because you don't metabolize it. So I guess we won't use that one now, and we'll switch it over to a different one. So that is helpful in that aspect. However, the downside is the cost. So with the hospital testing, as wonderful it is, I use it for a lot of my patients, and I continue to use it because it's necessary. Insurance doesn't always cover it, almost never. Private insurance typically doesn't. Medicare, Medicaid doesn't really cover it, so people have to pay out of pocket for it. So the cost here is like $237. You can pay, it has to be cash. You have to pay a time of service. We try to prior authorize it through your insurance, but most of the time it's not covered. So GeneSight testing is a little bit different. It almost always is covered by your insurance. Medicare, Medicaid is no cost, and our private insurance, I have never actually had a patient tell me that it's been a problem with any of their insurances, but they won't let you pay more than $330 for it. So the GeneSight people reach out to you if it's going to be horribly expensive and work with you. They do payment plans and all that other stuff, but just to make sure you're aware of those things. The pharmacogenomics and testing also can help us in our diverse population. So again, because of our genetic makeup, it really is true that a white person is going to respond to certain medications in a certain way, as well as treatments. That's going to be different than a Hispanic person or even an Asian person. So when we can get a little bit more specific about those things, then we get to eliminate some of the guesswork. It's why we know that we use some medications first for certain ethnicities, and why we don't use certain medications for certain ethnicities. That's all my stuff, I guess. The papers, you can look at them, whatever. The little green pamphlet also just kind of goes into it a little bit more. We keep those in our office so people can take them and read them at their own leisure type of a thing. So, what questions, if there are any?
How long has this been in existence?
This has several years. So,
Did they at one time do something with blood work?
Right, yes, because the one that the hospital does is a blood draw.
Okay.
Yeah, so that is, so there's the cost of the test plus the lab fee that goes on with it. That is the one that is more in depth and covers all of those other classifications, where this is just a swab and just looks at those mental health ones. Yes?
Are our doctors likely to recommend us getting this, or is this just something we have to be proactive on our own?
It can depend on your doctor. So I know that there are patients that get referred to me from the clinic because they have been on a number of medications, and the doctors are just like, I'm at a loss, please help. So this is what we do typically when that happens. And the things that we find out about the genetic makeup can be quite amazing. I know that our clinic is aware that this is something that we do, but I also know that they try, if they have people coming in with mental health stuff, they try to shoot them over to me. So this is just one thing that they don't have to worry about. Like I know up in Avera, they will do a pharmaco, like the big one, if you're older or if you've got a really bad illness, disease, sickness, and you're not responding to things. So they'll just do it initially. I don't know if it's approved then. That's way out of my realm, but they will do it. So people will come back and say, yeah, they did that test, and now I know why hydrocodone doesn't work. So. Any other questions? Thoughts? Yes.
So if we want this testing done, does it have to go through our doctor? Or can we just
You would make an appointment at my office. Yes. We do have people who are already established patients that will call and say, yeah, just come in, we'll quick do it because it doesn't take very long. We do like to make sure that if we're going to do it, that you are a patient that I've seen or that I'm going to see, because otherwise you'll just have these results and might not know what to do with them because it's can be quite complicated when you start reading it. We keep a copy for each person. Everybody gets their own copy when it gets done, and then we keep a copy in the chart, so it's something that can follow you wherever you go.
So you're mostly checking mental.
I am, yes. The ones that I do at my office are mental health. Yeah.
What about like the heart?
Those ones, that would be the
Passed out.
at the hospital.
And they're passed out for generations.
Yes. So, yeah, our genetics do so much for us, and that is why when people come to me and say, well, my boyfriend's sister was on this medication and she didn't like it because it made her super sick and I don't want to take it, I typically tell them, well, unless you share the same parents, we don't know that that's going to happen to you. So, especially if it's a medication that we know that typically works. There's always certain ones that we start with because they almost always work. But yeah, we get people who say, no, that one made me sick, that one made me extra jittery, or I became paranoid with it. And I'm okay, well, we're not gonna do that. In our day and age, it's quite normal for people to look on the internet to see what are the possible side effects for medications, what we should be watching out for. And I totally advocate for people to be proactive about their health, especially their mental health. But it's important to remember that A, not all the side effects that are listed are actually going to happen. B, they have to list them because otherwise something bad will probably happen. And then C, each person is going to respond differently.
So what do you think of the over-the-counter ones for mental health?
Such as
Prevagen and all that.
those are tested in a different way. They will not show up on these types of testing because they are not ones that are like FDA regulated. So that is the trick. It also, like, if people take St. John's wort, that's a very important thing to make sure that you tell people, especially if you're going to be on a prescribed antidepressant, because it counteracts each other and it makes things worse. So that's why we also ask, what other supplements are you taking? It's because we want to make sure that we don't make you more sick than what you could potentially already be.
What is it about smoking then? Because that's not necessarily a genetic thing. It's like
Right,
someone
so-
chooses to do. So what about that makes it?
So that when we smoke, if you are a smoker, we're a smoker, there is an extra like protein enzyme that is triggered and activated. So then it changes how that medication is metabolized. So if you've never smoked, it's not really anything you have to worry about. And if you haven't smoked in like several years, not really something they have to worry about. And of course, that is a big question that I have really focused on with our younger generation, because so even though it is illegal to own a vape under the age of 21, I believe, or cigarettes under the age of 21, they still have it. So I ask. A lot of them are very hesitant, and I always tell everybody, I care, but I don't care. I just need to know for medication purposes. Anything else? Wonderful. Well, thank you for coming. Also, just a little tidbit out there, September is Suicide Awareness Month. So just make sure that people know mental health is okay to talk about. It's okay to reach out to someone, anyone. We have resources here, there are resources within our schools, there's other resources within the community. It's okay to talk about, and please do.